and welcome to ETHealthworld.com. I am Rashmi Mabian, and for today's interview, we have with us Dr. Sudhakar. He is the Radiologist and Specialist in Breast Imaging at HCG Hospital, Bangalore. Dr. Sudhakar is a renowned radiologist with over 15 years of rich experience in this field. A very warm welcome, Dr. Sudhakar. I would like to begin by knowing about the current breast cancer scenario. So, how do you see the incidence of breast cancer in India, and are we seeing a rise?
Yeah, definitely. Thanks, Rasmi, for the brief introduction. So, as of now, the breast cancers are increasing decade by decade. And in the present 2020, the number of cases were 7.8 millions. And every year, it's been gradually increasing. And this is one of the commonest cancers in the urban population now.
So, is breast cancer more common in older or younger women?
In few decades back, like 2-3 decades back, we used to see often the ladies with more than 50 years getting it. But of late, in the last 2 decades, what happening? There is a slight drift in the breast cancer incidence. It's coming more often in a young age, like 30 to 40 years of age. That is significantly high compared to the 2-3 decades earlier.
Could you also tell us about some symptoms of breast cancer for our viewers to actually gain more insight on this?
See, most of the time, the breast cancer, they are all painless. So typically, a normal woman gets a pain before their menses starts. In all those symptoms, you don't get it in a breast cancer. So what you can get is a faint hardness in one part of the breast. So unless a woman do a regular self-breast examination on her breast, comparing to the opposite side, they'll not make out which is a hard area, which is a soft area. So that is the earliest thing to pick up. Once the lesion goes slightly bigger, then there will be changes on the skin, like we call it as orange peel appearance. Just like orange skin, there will be some swelling on the skin. There may be some redness, or there is something called a puckering of the skin, we call. Just like a saripal, how there are frills you can get. Like that, you get a small frills on the skin. That's called the puckering of the skin. Also, there can be a nipple discharge, especially when a lady after a lactation, if she continues to have a discharge 3-4 years after breastfeeding. Sometimes there can be a whitish discharge, some can be reddish or greenish. If it is a reddish discharge, it's more concern. If it is of yellowish or whitish discharge, that's of not that much concern. And sometimes very rarely we see some dark skin appearance on the nipple area. So that, and there'll be consistent itching and discoloration of the skin and all. So those are all the signs. And there are very rarely we have seen some cases where they'll develop some hard swellings in the armpit. So we call it as a lymph nodes. So those are the early signs of it.
And how often do you think that women should go for regular screening?
See, actually it depends upon the two patterns. One is, do the women have any family history, or they don't have any family history? Those who don't have a family history just want to get health check. So for them, less than 40 years of age, 35 to 40 years of age, they can get an ultrasound scan every yearly. And once they reach 35 to 40 years of age, that's the time they can start do a mammogram yearly. That is for the general population where they don't have any history of breast cancer. For the people who have a breast cancer history, for example, a mother or some aunt or uncle who has a breast cancer history. So for them, we have to start screening 10 years earlier than the incidence of the patient. Like for example, if the mother had a breast cancer at 45 years of age, the daughter should start screening by 35 years of age. So 10 years earlier than what the mother has got the symptoms. So either they can get an ultrasound scan or a mammogram. So yearly is recommended.
Could you also tell us a little about the vacuum-assisted breast biopsy and what exactly is this technology? How does it work?
So this is once we suspect there is any lesion in the breast, and the lesion we want to know what it is. So earlier days, like few decades back, we used to do a surgery to remove the lump and then send it for lab to see what it is. But now what we can do is with the biopsy techniques like vacuum core biopsy, we can take out the lesion. In fact, if it is a smaller lesion less than 3-4 centimeters, we can take out the whole lesion and we can send it for the lab. So that will that will treat the patient as well as that will also give us a diagnosis what it is. So most of the time now in our institute, what we are doing is if it is a very small lesions and patients are worried about, even though we say that it's a benign disease, they are worried about the mass. So such patients will offer them the vacuum core biopsy, where with a small needle, I can take out the whole lump, and that's a daycare surgery. Like they come for half an hour, 1 hour maximum. The same day they can go back. So that is a vacuum core biopsy for removal of the breast lump. We can also do this whenever there is a small lesion. Suppose generally they are coming up with a screening and suddenly 1 year they develop something new lesion which was not there before. So generally this is called a developing new lesions. So those developing lesions, they are very small. Okay. So whenever you attempt to do a biopsy for such a small lesion, we will not be able to get a good amount of tissue. So that's where the vacuum core biopsy plays in. So vacuum core biopsy, what it does is we can go through the guidance, whether mammography guidance or it's an ultrasound guidance. We can go in precisely to the area of concern. Then we can take a good amount of tissue. Without surgery, we'll take a good amount of tissue from the area of concern. Then that will be sent for the lab. That gives a good diagnosis than compared to the regular needle biopsy.
So with VABB, you can not only diagnose but also remove the lumps in the breast?
Yes. So especially though something like a benign disease, for example, a fibroadenomas or a ductal papillomas or ductal lesions which are benign, so which are proved benign, what we can do is we can give a small local anesthesia. We can go all around the lesion, anesthetize the lump area. Then by this vacuum core biopsy, we can take out the whole lesion piece by piece. We can take it out. It will hardly take half an hour to 1 hour for, and it is very it's not a cumbersome process. It's just like doing the ultrasound scan. I'll be seeing the images throughout the process. I'll be talking to the patient. Patient will be conscious. If they want, they can see the images also. So it's a very comfortable procedure, and the whole lesion can be removed in maximum of 1 hour.
Right. So do you, with these benign lumps, are they a common occurrence or formation in the breast?
Yeah, this is very common. The fibroadenomas is very common among the young ladies, especially like 50% of population. Sometimes they'll get it. So they'll feel a hard, lumpy kind of thing, especially young breasts. So where the normal tissue and the fibroadenomas, they all look similar. So once they do a scan, they'll be able to know ultrasound scan. So once they do an ultrasound scan, they'll be able to see the fibroadenomas, which are very well defined and round or oval ones. So those are very common conditions, and especially those who have a family history, those are the one we are picking up and removing off the lesion. Otherwise, if it is a small lesions, not growing in size, remain the same for a couple of years, no need to do anything. Only for those which is growing slightly in size, or they're worried about the lesion, or they have a strong family history of breast cancer. So those are the patients will give an advice for vacuum core biopsy.
And how beneficial do you think vacuum-assisted breast biopsy is in early detection of cancer?
No, this is definitely very useful, because here we are taking a good amount of samples. Sometimes in some instances it happened like this. So they come with a 5 millimeter of tumor. I removed 1 centimeter area. So the whole treatment is gone. So this is as useful as that. And even, for example, if they have a ductal nipple discharge or something, and if they have a papilloma, so the whole symptoms will disappear. The lesion will disappear and symptoms will also disappear along with it. So it will be very useful in early stages and also for small lesions.
So when we talk about the removal of lumps via VABB technology, does it require hospitalization, or how long is the stay?
It's not, hospitalization are not required, because these all come under daycare procedure. Like if the lesions are less than 4 centimeter, or 3 centimeter, we can remove it in a daycare. If it's slightly bigger and patient is apprehensive, that's the time we'll admit and do under general anesthesia.
Right.
So if they are we do a general anesthesia, for that we require admission. If it is a smaller lesions, we'll do in a OPD basis. They come in the walk-in and walk out in the same day.
And how is the awareness that you find, and how aware are the Indian women population about such advanced diagnostic procedures like VABB?
Not many know about this advancement because everybody go for a needle biopsy, and especially an advanced technology like this, where an early disease can be picked up very soon. So that will be very useful in terms of staging of patients. For example, if the patient comes with an early stage like less than 1 centimeter, and if we diagnose, that will be stage 1 disease. And the same lady, if she comes with once a lump is more than 3 or 4 centimeters, it is a stage 2. Stage 2, it will not be much useful. Whenever they come in an early stage, though we can give a good tissue diagnosis, that will be useful for them, where they can remove the whole lesion, and that will definitely benefit for them.
And are more physicians adopting this technology for both diagnostic and therapeutic solutions in breast cancer?
Especially the breast lumps in a young age, where they don't want to go for surgery. So this is one of the options for them. Say generally for a surgery, once they undergo surgery, there will be scar on the skin on the breast. So here we don't use any blade to cut or anything. So just a needle. So absolutely there won't be any scar on the skin. So this is very cosmetically very lucrative. Right. So there won't be any scar on the surface at all.
So like we've talked about how beneficial the technology is, could you also highlight on how does the delay in seeking timely treatment impact on the health of a breast cancer patient?
So definitely, as I told, see, if we detect the lesion in an early stage, it will be beneficial for the patient. They can, from stage 0 to 1, they are absolutely, we have a normal lifestyle, normal lifespan. So once the lesion grows bigger, then they'll definitely upgrade the disease from 2 or 3. So early disease is curative, in fact, if it's detected in stage 0 and 1. So once it is a bigger, then the chances of survival is also low, and they have to end up in surgery, chemotherapy and all. So those things can be definitely avoided with this.
Lastly, Dr. Sudhakar, what is your message to our women viewers and their families?
So first thing is, everyone should do a self-breast examination. So what happens in Indian scenario is, once she gives birth to a baby, she'll forget her organs. She'll think that once the breast milk is fed, so the job of breast is done. It is not like that. So they have to have a self-breast examination every month. So that will give us an indication. In fact, themselves, when they feel, they can pick up the lesion much earlier. So that will be very useful, self-breast examination. Or other thing, if at all they feel any lump anywhere in the body, anywhere in the breast, so let them get an ultrasound scan that is painless. Or if they are more than 40 years, they can do a mammogram. If they are worried about mammogram, where we compress the breast and do a X-ray imaging, if they are worried about that, then we can do a ultrasound scan. That will be equally good, where you can differentiate whether it is a benign or malignant. If it's a benign disease like fibroadenoma, they need not do anything. It can be ignored. If they are something like a suspicious needle, then we can offer them a vacuum core biopsy or a simple breast biopsy. So that will be detected early before they actually land up in a problem. So here, the early diagnosis is a key in treatment of the breast cancers.
Very important message given there, sir. Thank you so much, Dr. Sudhakar, for sharing those crucial insights on the incidence of breast cancer and explaining the benefits of vacuum-assisted breast biopsy. It was indeed a pleasure talking to you, and I really look forward to connecting with you again. Thank you and have a great day.
Thank you.